always remember, Manong knows.
This video is sponsored by Asia United Bank. Aspire like no other.
Sa pagharap ng bagong araw, sila pa rin ang iyong inaalala. Gaano man ang pagod, hangad mo pa din ang sa kanila'y maging kaagapay. Salamat sa iyong malasakit para sa iba at lagi mong isipin, sa'yo din ay may handang tumulong at kumalinga. We care for you because you cared for others first.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Hi, I'm Marco Bondoc. I'm a Global Studies Manager for a multi-billion-dollar pharmaceutical company. I'm here today to share my journey. First of all, I started as a staff nurse in Essex, in one of the hospitals there. I was hired actually as a staff nurse to start with. I worked there for 5 years in various clinical areas, but particularly my main clinical background really is in respiratory and endoscopy nursing, and as well as a bit of cardiology nursing and research nursing. So that's what got me in the door. So I became a research nurse for 2 years, and I capitalized on that experience. And then I just, after a 2-year stint as a research nurse, I looked for a job in industry, and I went out there, sent my CV out. I applied for my first industry role, and I managed to clinch it because I did well in the interview, and I got in. And from then on, I could say that the rest is history. So I moved on different research clinical trial roles from that point on. So from a site-facing to now I'm working on behalf of a sponsor. So I started out as a research nurse. Yun talaga yung pinakauna mong dapat gawin. Must have clinical experience to start. Hindi ka pwedeng basta-basta maging research nurse instantly. That doesn't happen instantly. For example, hematology oncology nurse ka kunwari, tapos nag-hematology specialist nurse ka. So if you wanna go into research, you look for hematology research nurse jobs. So yun yung mga hahanapin mo. Advice ko talaga ngayon is yung pinaka-common or pinaka-in-demand sa industry ngayon is oncology. So oncology is a multi-billion-dollar business. Kuha ka na ng at least 2 years of solid clinical research experience with a specialty, pwede ka na mag-apply into entry-level clinical trials roles within industry. For example, Clinical Research Associate 1, Associate Project Manager, Study Coordinator, like me, I started as a Study Coordinator. Clinical Trial Administrator, pwede din yun kasi marami siyang, those are really entry levels because from that, pag nakapasok ka na dyan sa mga entry level na yan, kasi ma-associate na yung company name sa CV mo, pwede ka nang umakyat from there. You can build it up. So you can just slowly, do 1 to 2 years or 2 years at least. In my case, I did 1 year, 2 years, and then I moved, every time I moved. If you look at my CV, it's very like 2 years max. And then I then move and apply for another role. And kasi ako, this is just my personal experience. I really like the feeling of going into an interview and then getting the job. I think I get a natural high from that. But, I don't advise that to everybody. At least people should be loyal to the company or whatever. But yeah, that's just me. But it's also a good, one tip that I could give. When you do that kasi, the thing is you can negotiate your package as well. So that's what I did as well. It gives yung advantage ko sa paglipat-lipat na ganyan, nakakaroon ka ng bargaining leverage. Kasi, but you don't, you just have to make sure that you come across as being able to do the job. There's a misconception about research nursing. We don't think of the idea. We don't instigate the research. It's more of running it, managing the project, and I think I like doing that. I'm really, and I think there's being a staff nurse or a nurse in general, you have transferable skills. Ang challenge talaga, ang biggest challenge is, this is a heavily regulated industry. It's admin heavy. I eat paper every day. My role is email based, meeting based. It's all wala ka ng patient contact, and I think that's one of the biggest hurdle. And you must be able to communicate really well. I mean, not just the ability to speak English, but also interpersonal communication. There's a lot of, when you're in the corporate world, there's a lot of things that you have to abide by, the corporate nuances and things like that. So if you like those kinds of things, this job will probably be for you. And it involves a lot of, trivial paperwork, it might seem. You might think, like the way dates are formatted, the way time entry is formatted, but these things are a big deal in our industry. It might be trivial to a very busy ward. Why should it matter? It matters because we are inspected all the time, and drugs don't get approved if we don't prove that we done due diligence. Let's start with work-life balance. It is what you make it out to be. For example, we're not obsessed with hours. We're not set, you have to, it's not like a typical, you have to build, you have to clock in at 7 and leave at exactly 5 on the dot. And as long as we deliver the project, it doesn't matter how short or how long your day is. But obviously, you have to, it's about working smart. And that's what I like about it. You're free to work anywhere in the world, any location, from my company anyway. You can be remote, you can be in the office twice a week. So it's quite really flexible. But then, of course, there's a demand. There is there's an expectation, there's a deliverable. You know that there's a project at the end of the day, at kailangan mong i-deliver yon. So, and also, my perks then in terms of travel, I've got a car allowance, travel is reimbursed. If you travel for business, you're flown business class. That's the expectation all the time. And I've got an annual, I have a share, we have a share buy. I can buy shares in the company and sell them after 3 years. There's a lot of perks really. Aside from the financial remuneration, there's also, you have life insurance, you have accident insurance. So there's a lot of really good benefits. Although I must say that the NHS pension scheme is still unparalleled. So that's still the best pension scheme out there. So that's just the downside. No one can, it's incomparable. I think I am quite rewarded for the job that I do. And that's the main thing. And I don't have to work too much extra. I don't even do bank anymore. Basic entry levels of pharmaceutical industry, based on my experience, ballpark figure, you can start up to 30 to 35,000. That's the basic entry level salaries for that's normal pharmaceutical level entries. That's 30 to 35,000 pounds per annum, and you could go up to 6 figures. If you want to. But you must bear in mind that the more you go up, the more stress, the more job, the more responsibilities. But yes, basically you can go up to 6 figures. And I know people who are on 6 figures in my company and in the pharmaceutical industry in general. And and you can even shift to contracting. You can be self-employed, do contracts. You can just do one aspect of the drug development process. You can do independent monitoring, auditing, and you can be paid as much as 400 to 700 pounds per day. And do the math. And that's just 7.5 hours in a day, or 4 hours, depends on what your deliverable is, or it could be 10 hours. So that's, like I said, you're given a daily rate because you're expected to deliver something. So ganun yung mga rates na just give you a ballpark figure. And right now, I would say yung basic ko, I would say I would be equivalent to a band 8D-ish top end.
Visit FilipinoUKNurse.com for Filipino UK nurses made by Filipino UK nurses for articles like this, or this.
Okay, so the bonuses range depending on which company. It usually ranges from 11.5 to 15%. Could go up to 20% depending on how I performed throughout the year and how the company performed. So I could get as little as 5,000 tax, free of tax, to a maximum of 10,000 net, free of tax. So if you want to maintain it, do 1 long day per month during the next 2 years. If you've been doing, let's say, for example, ako ngayon, siguro mga 2 years na akong wala sa practice, so kailangan ko nang bumalik, I would probably do 1 long day per week para mabawi ko yon sa next kong revalidation. I have to make sure na ma-accumulate, basta lang ma-accumulate mo so you can do like weekend jobs, pwede mong i-maintain kung nasa A&E ka or may agency ka, mag-community ka. One good tip now is we have a mass vaccination program. Pwede ka you can register with an agency that could, give the vaccines, and that would count as clinical hours. And that's what I'm gonna do actually, just to make up because I want to maintain my PIN. Kasi pinaghirapan mo yun you don't want to lose it. Kaya natin, kaya natin as Filipinos because we are naturally hardworking. We have, good command of the English language. There is no reason why we can't take a piece of this pie. If you know what I mean. There's really no reason. There's no limitation because once you're in it, the sky is the limit. Everyone, to really, if you really want to go into this kind of industry, malaki ang pera. I cannot lie. Ayokong maging plastic na mag-say hindi ako mas malaki yung pera mo talaga. So mas malaki yung sahod, and kahit na magtrabaho ka until midnight, worth it naman kasi bayad ka naman talaga. So and tayo naman wala tayong reklamo sa hard work. I have an aspiration. I have a big dream. Like, kung anong ma-learn ko dito, dadalhin ko sa Pilipinas. You can outsource things. And it could be like, you can build a research infrastructure there. I know there is already one existing, because a lot of companies are outsourced. But the market share of outsourcing right now is in India. So India holds the monopoly of outsourced services in clinical trials. And I think, just like what we did, we overtook India sa call center industry. I think we can overtake India sa clinical trials industry.
Always remember, Manong knows.